This is you, and this is a person having a convulsive seizure. Do you know what to do? The Canadian Epilepsy Alliance proudly presents Seizure First Aid and you. Seizure First Aid requires only one thing: responsibility. The responsibility to use your brain to help others. So first things first. You may not know this, but not every type of seizure causes a person to fall to the ground and shake. Yes, that's right. There are in fact many different types of seizures. Some seizures will make a person have a blank stare for a few seconds. Some seizures will make a person unintentionally pick at their clothes or nearby objects. Some seizures will make a person simply flutter their eyes. Sometimes a person will have a seizure and you may not even notice. Because the fact is that seizures are rarely a medical emergency. So by learning more about seizures and seizure first aid, you are doing your part in helping create a brighter, more educated future. So let's begin. This is you, and this is a person having a convulsive seizure. The very first thing you need to do is remain calm. If there is something soft nearby, like a sweater or a pillow, gently place it between the person's head and the surface. The person's limbs will be rigid and jerky. Do not try and restrain them. At this point, all you need to do is stay by the person's side and let the seizure run its course. When the seizure finishes, the person will be dazed and tired, so offer them a nice place to relax, like a nearby couch or a bench. Simply reassure the person and comfort them as needed. As previously stated, some people with epilepsy have seizures that cause them to unintentionally wander. If you are with a person when this happens, simply guide them away from any dangers like nearby staircases or local traffic. So now you know about seizure first aid, but what you also need to know is when to call 911. Knowing when to call 911 is very important, because the person does not have to have epilepsy in order to have a seizure. Potentially anyone can have a seizure, simply because we all have brains. So call 911 if the person has suffered a physical injury, or if the person has a seizure in water, or if the person is diabetic, or if the person is pregnant, or if regular breathing does not return after the seizure has ended, or if you know the person has epilepsy and the seizure lasts for more than 5 minutes. So be sure to keep track of how long the seizure lasts so you know whether or not you need to call 911 if the seizure lasts for more than 5 minutes. So remember, seizure first aid requires only one thing: responsibility. The responsibility to use your brain to help others. Because a brighter future is possible, and it starts with you. The funding for this education has been provided by the Ontario Trillium Foundation, LIBRO Financial Group, and the United Way.